Alright, so sorry, I actually titled this video as healing fracture, but the real name of this video is actually stages. Alright, in you say stages in the healing of a fracture. Okay, so let's quickly look at the stages. Okay, so let's look at it. So stages in the healing of a fracture is just a step by step to what brings about. You had a bone fracture, but the fracture healed anyway. Alright, so stages in the healing of a fracture is what we are going to discuss this morning. It's what we are going to discuss this morning. So that bone healing is actually a biological process, and it restores the normal integrity and the strength of that bone. So the fracture disrupted on one or two, but you understand, because the healing process comes in, it actually repairs everything back. So what are the stages of fracture healing? The first one is hematoma formation. It's also known as the inflammatory phase. So the time frame is just few days after the fracture. Now bone vessels at the fracture site are forming clots. This will reduce bleeding. So it provides a framework for inflammatory cells and signals to start to come in. So there's a lot of swelling, there's a lot of pain, there's a lot of warmth at this stage. Then we have the soft callus formation. That's a fibrocartilaginous phase. So time frame is about 1 to 3 weeks. So you have fibroblasts and chondroblasts infiltrates. Okay, you get to produce collagen and cartilage. So this will stabilize the fracture with a soft, flexible tissue bridge. So the pain will decrease, and there's early stability. Now, what's it? Alright, this is the first stage that we spoke about. Now, this is the next stage we are looking at. That's the second. We have looked at the second stage, right? We are going to the third stage. So the third stage now is hard callus formation. That's between 3 to 8 weeks. So osteoblasts will actually form. Osteoblasts will lay down woven bone, replacing callus. Okay, providing rigidity, and fracture lines begin to disappear on the X-ray. So clinical sign is there's improved strength, there's reduced tenderness. Alright, so the last stage is bone remodeling. So bone remodeling takes months to years. Okay, so woven bone is now replaced by lamellar bone. So osteoclasts resolve excess callus. So this will now restore the bone's original shape. But at this stage, if the shape is not restored properly, if the thing doesn't go very well, alright, you now have all those abnormal callus formation and the rest of it. So what are the factors that affect how fast a fracture will heal? Okay, good blood supply, proper immobilization. So you have a fracture, you don't get moving that part of the body like you used to move before. Adequate nutrition. You have to be taking, those are the positive influences. You have to be taking good food. Okay, good carbohydrates, good proteins, good vitamins, and everything. So negative influences, if there's poor alignment, okay, if there's infection at the fracture site, if you smoke, if you have underlying diabetes, if you use a lot of steroid, if there's severe tissue damage. All right, so types of fractures, we have the primary fractures as direct healing types. We have the secondary, which is indirect healing. Don't worry about all of this. This is just like we'll come back and talk about all of those stages involved in healing a fracture.